Certified Medication Aid Written Exam Practice Test.
Question 1. Which of the following is an incorrect statement regarding the application of nitroglycerin cream? Option A. Do not place the medication on the same area of skin with each application. Option B. Apply the medication to an area of the skin that is not open. Option C. Rub the cream into the skin. Option D. Apply an accurate dose.
The correct answer is option C. Rub the cream into the skin. The correct answer is rub the cream into the skin. This is the safest and most appropriate medication aid response for the situation.
Question 2. When administering medication into the ear canal of an adult, it is important to do what? Option A. Not touch the tragus of the ear. Option B. Pull the pinna of the ear up and back. Option C. Push the ear tragus forward. Option D. Pull the pinna of the ear down and back.
The correct answer is option B. Pull the pinna of the ear up and back. The correct answer is pull the pinna of the ear up and back. This is the safest and most appropriate medication aid response for the situation.
Question 3. Instilling nasal medication requires the medication tech to position the patient with which option? Option A. Lying on his or her back. Option B. Lying on his or her side. Option C. Sims position. Option D. His or her neck hyperextended as able.
The correct answer is option D. His or her neck hyperextended as able. The correct answer is his or her neck hyperextended as able. This is the safest and most appropriate medication aid response for the situation.
Question 4. Which of the following medications may be appropriate to crush for easier swallowing? Option A. Tylenol. Option B. Contact time release capsule. Option C. Indral XL. Option D. Enteric-coated aspirin.
The correct answer is option A. Tylenol. The correct answer is Tylenol. This is the safest and most appropriate medication aid response for the situation.
Question 5. For the treatment of gastroesophageal reflux disease, providers sometimes prescribe drugs that help move food faster through the esophagus and stomach. What are those drugs classified as? Option A. Prokinetics. Option B. Antibiotics. Option C. Hyperkinesias. Option D. Probiotics.
The correct answer is option A. Prokinetics. The correct answer is prokinetics. This is the safest and most appropriate medication aid response for the situation.
Question 6. Frequently used medication that may be kept in the medication room are commonly referred to as which option? Option A. Community shared medication. Option B. Computerized dispensing system. Option C. Unit dose. Option D. Stock medication.
The correct answer is option D. Stock medication. The correct answer is stock medication. This is the safest and most appropriate medication aid response for the situation.
Question 7. For which of the following individuals would you withhold oral medications? Option A. A patient who is unconscious. Option B. A patient who has had a stroke and needs to have liquids thickened. Option C. A patient who is awake and alert and has no deficits. Option D. A patient who is blind.
The correct answer is option A. A patient who is unconscious. The correct answer is a patient who is unconscious. This is the safest and most appropriate medication aid response for the situation.
Question 8. How long should a patient lie flat after you administer a rectal medication? Option A. 15 to 20 minutes. Option B. 5 to 10 minutes. Option C. 0 to 2 minutes. Option D. 2 to 5 minutes.
The correct answer is option B. 5 to 10 minutes. The correct answer is 5 to 10 minutes. This is the safest and most appropriate medication aid response for the situation.
Question 9. Antidysrhythmic medications are used to treat all of the following conditions except for which option? Option A. Irregular heartbeat. Option B. Tachycardia. Option C. Hyperlipidemia. Option D. Hypertension.
The correct answer is option C. Hyperlipidemia. The correct answer is hyperlipidemia because it is the choice that does not match the stated medication aid principle.
Question 10. Which of the following conditions the patient needs to be observed closely when starting a patient on a beta blocker for hypertension? The medication aid knows that if the patient has option A, asthma, option B, angina, option C, hyperlipidemia, option D, vascular hypertension.
The correct answer is option A, asthma. The correct answer is asthma. This is the safest and most appropriate medication aid response for the situation.
Question 11. By what system are nutrients and oxygen-rich blood transported to organs and tissues? Option A, pulmonary system. Option B, urinary system. Option C, lymphatic system. Option D, cardiovascular system.
The correct answer is option D, cardiovascular system. The correct answer is cardiovascular system. This is the safest and most appropriate medication aid response for the situation.
Question 12. The blood pressure measures the amount of pressure on the arteries. With which of the following instruments can these sounds be heard? Option A, defibrillator. Option B, stethoscope. Option C, sphygmomanometer. Option D, cardiac monitor.
The correct answer is option B, stethoscope. The correct answer is stethoscope. This is the safest and most appropriate medication aid response for the situation.
Question 13. For what do all statins, potent antilipemic medications, have all the following possible side effects except? Option A, diarrhea. Option B, muscle weakness. Option C, muscle soreness. Option D, anorexia.
The correct answer is option A, diarrhea. The correct answer is diarrhea because it is the choice that does not match the stated medication aid principle.
Question 14. Which of the following medications is used with other antihypertensive medications to enhance their effect? Option A, calcium channel blocker. Option B, beta blocker. Option C, diuretic. Option D, angiotensin converting enzyme inhibitor.
The correct answer is option C, diuretic. The correct answer is diuretic. This is the safest and most appropriate medication aid response for the situation.
Question 15. Which of the following is not used to treat a patient with high cholesterol? Option A, percentin. Option B, Pravachol. Option C, Lipitor. Option D, Mevacor.
The correct answer is option A, percentin. The correct answer is percentin because it is a choice that does not match the stated medication aid principle.
Question 16. Which of the following are two side effects of vasodilators such as nitroglycerin? Option A, anorexia and fatigue. Option B, dizziness and weakness. Option C, headache and hypotension. Option D, nausea and vomiting.
The correct answer is option C, headache and hypotension. The correct answer is headache and hypotension. This is the safest and most appropriate medication aid response for the situation.
Question 17. Before giving a cardiac glycoside, which of the following does the medication aid need to know first about the patient? Option A, heart rate. Option B, pain level. Option C, temperature. Option D, blood pressure.
The correct answer is option A, heart rate. The correct answer is heart rate. This is the safest and most appropriate medication aid response for the situation.
Question 18. Which of the following statements shows that the medication aid needs more education about the medication Cardizem XL? Option A. The medication can be crushed if needed. Option B. Hypotension can occur when taking the drug. Option C. This medication may decrease episodes of angina attacks. Option D. There are no difficulties in taking this medication and antacids at the same time.
The correct answer is option A. The medication can be crushed if needed. The correct answer is the medication can be crushed if needed. This is the safest and most appropriate medication aid response for the situation.
Question 19. Which two expectorants are commonly used in the long-term care setting? Option A, Robitussin and potassium iodide. Option B, Atrovent and Prevental. Option C, Singular and Loratadine. Option D, Spiriva and Benadryl.
The correct answer is option A, robitussin and potassium iodide. The correct answer is robitussin and potassium iodide. This is the safest and most appropriate medication aid response for the situation.
Question 20. Singulair, montelukast, is most often used with other medications to control asthma. What is the most important factor to remember when using Singulair? Option A. It may lead to fewer symptoms during the night. Option B. It may lead to fewer asthma attacks. Option C. It may reduce the use of a fast-acting bronchodilator over time. Option D. Singulair is not a fast-acting drug and cannot be used in the place of a rescue bronchodilator.
The correct answer is option D. Singulair is not a fast-acting drug and cannot be used in the place of rescue bronchodilator. The correct answer is Singulair is not a fast-acting drug and cannot be used in the place of rescue bronchodilator. This is the safest and most appropriate medication aid response for the situation.
Question 21. With which of the following medications can bronchospasms in chronic obstructive pulmonary disease be effectively treated? Option A. Zyrtec. Option B. Vicodin. Option C. Afrin. Option D. Albuterol.
The correct answer is option D, albuterol. The correct answer is albuterol. This is the safest and most appropriate medication aid response for the situation.
Question 22. Which of the following types of pneumonia results in damage to the surfactant level in the lungs? Option A. Aspiration. Option B. Viral. Option C. Bacterial. Option D. Primary.
The correct answer is option A, aspiration. The correct answer is aspiration. This is the safest and most appropriate medication aid response for the situation.
Question 23. In asthma, the smooth muscles in the airways become severely constricted by an overstimulation from various sources, which may be either extrinsic or intrinsic. Which of the following is not an extrinsic source? Option A. Cigarette smoke. Option B. Anxiety. Option C. Pollen. Option D. Dust.
The correct answer is option B, anxiety. The correct answer is anxiety because it is the choice that does not match the stated medication aid principle.
Question 24. Baking soda is commonly used by the elderly for heartburn. Which of the following is not a possible side effect of the medication? Option A. Dehydration. Option B. Acidosis. Option C. Alkalosis. Option D. Edema.
The correct answer is option C, alkalosis. The correct answer is alkalosis because it is the choice that does not match the stated medication aid principle.